to take up a very important topic, that is care of women after 40. It has been observed that a lot of female tends to neglect their health. They are the pivot for the entire family's health, but somehow when it comes to their own health issues, they are very reluctant to even seek help, or even take an initiative to ask for help from the doctor itself. I have picked up a few topics which I think are very important for females who are more than 40 to take into consideration. I start with breast cancer screen. So I'll be mainly dealing with what all screenings should a female get done and what all care she should take after the age of 40. I have particularly chosen breast cancer screening as my first topic because lot of females have a lot of apprehensions, lot of myths about whether they should get breast screening. Or I don't have anyone in my family with a history of breast screening. Should I be getting it done? What will be the consequences? And there are so many more questions. Highlighting that what are the breast cancer statistics in our country. Sadly, breast cancer, which was very common in the Western countries, is now becoming the most common cancer in our country in the urban population. So I'll be largely talking about the urban population. And the alarming statistics is that it is responsible for about 25 to 32% of all cancers in females. The where we are lagging, why is there a rise in these cases, is because of lack of screening. And more than 30% patients now are younger than 60 years. And because of lack of screening, regular screening, more than 50% of breast cancer patients present to us or come to us in stages 3 and 4, where which after which the treatment is very prolonged, and sadly the outcome is very poor. That is why we lose patients. Now, talking about the risk factors, we need to know what are the risk factors which can lead to breast cancer. When we talk about risk factors, there can be two kinds of risk factors. One which are non-modifiable, which we cannot do anything about it. And the other would be the modifiable risk factors, about which we can do something from our part to reduce our risk. Now, coming to the non-modifiable factors, first is the reproductive history. It has been seen that females who have no children or fewer number of children, or who plan their pregnancies at a very late age, are at a higher risk of developing breast cancer. Then somebody who has a family history of breast cancer, one of the close relatives like a mother or an aunt or a sister with a history of breast cancer, or she herself has a history of some kind of cancer, breast cancer in one of the breasts. Okay, now race. When it comes to race, largely speaking, in our country, it has been seen that somehow a particular race, maybe Parsis and Christians, they are said to be a little more at risk factor, but we cannot pinpoint in that point. Okay, now comes because of the menstrual history. People who have very early menarche and a late menopause, they are again at a higher risk of developing cancer. Talking about the genetic factor, there has been a famous case of Angelina Jolie, who got her genetic test done, and there is a mutation of a particular gene which can now be detected by tests, and if those been found, then the patient is said to be at a higher risk of developing breast cancer. Okay, and age, of course, as the age progresses, the risk of cancer increases to a certain age, which I'll be talking later on. But nowadays, the irony is that we are getting cases as young as in their 20s and 30s as well. Now, talking about some of the modifiable risk factors, see, the prolonged use of birth control pills, prolonged use of hormonal replacement therapy, they can increase the risk. obesity, which I'll be talking about later on also. That is one of the factors. If the patient's BMI is higher, then they are at a higher risk. Breastfeeding, so people who breastfeed their children for a longer duration, it's kind of protective. It's protective for them it protects them against cancer in that way. Not having children again creates a higher risk of breast cancer. Now, all women should look for these warning symptoms and should consult their doctor if they have any of these. Usually, it is felt as a painless lump or thickening in either of the breast. The lump that persists, sometimes the lump, some lumps tend to become smaller after the menstrual cycle, but these kind of malignant lumps, they tend to persist. Some patients can have pain in their nipples. There can be retraction of nipple, and there can be irritation of skin, and particularly a dimpling of skin, which we call as a pudgy orange appearance, like the skin appears like a peel of an orange. There could be discharge of any kind, sometimes even in severe cases bloody discharge can happen. But it is very important to note that we are right now talking about screening, because in early breast cancer, none of these symptoms could be, patient could not perceive any of these symptoms. Now, how do we detect it? So we advise the patients to do a self breast examination, doing it every month from the age of 20. And later on, we advise them to go for a clinical breast examination by an expert doctor, which should be done every year after the age of 40. And along with that, a mammography every 1 to 2 years after the age of 40 must be done. Now, what is a mammogram? Because, hearing from friends and relatives that, oh, mammography is X-ray, you're exposing yourself. But it's actually X-rays for the breast, but the amount is quite small. The exposure amount is very small. And of course, there is minor discomfort noted in some women because of the pressure on the breast. Okay. Now, what is the use of mammograms? Mammograms are the best methods to detect, and they are the best means for detect the cancer, and they can, and they have a very high efficiency of 85%. Maybe 15% will not be shown in the mammograms. We have an additional modality as breast ultrasound, which can be complemented with mammogram to confirm a diagnosis. And later on, if any doubtful lump is found, then we go ahead with further tests like taking a biopsy. And but those are further tests which are not recommended for everyone, only for people whom there is a doubtful lesion. My next important consideration, my next important topic is cervical cancer screening. Why am I talking about cervical cancer screening? Again, this is the second commonest cancer in our country in females, and it is the commonest cause of death due to cancer deaths in our country. So, as you can see, quite alarming statistics that in our country we find about 132 women are diagnosed with cervical cancer, and about 74,000 deaths occur due to cancer. Again, the stress is that this is one kind of a cancer which is the good news is that it can be detected in a very early stage. It has a very usually has a very long growth phase where it remains in a precancerous condition for a very long time, and with the tests available we can easily detect them in the precancerous stage. Though the incidence, young girls, now we are talking a lot about the HPV vaccine, but young girls don't need to worry about it because it's a cancer which is at the late age. So most of the risk factor, it increases after the age of 30 to 34 years, and it peaks in about 55 to 65 years. Now, quickly speaking about the risk factors of cervical cancer, the main causative agent in most of the cases of cervical cancer has been found out to be a virus. So, an infection with this virus, which is called the human papilloma virus, is the main causative agent. Others Smoking has said to increase. Now, immunosuppression, patients who are on immunosuppressive medicines because of some kind of an autoimmune disease, or now since HIV, we talk about HIV, but HIV is now on a decline in our country. So, immunosuppressive conditions like HIV, patients who have sexually transmitted diseases and which is untreated for a very long time, and they have very frequent, somebody who has very frequently getting sexually transmitted diseases, and somehow the diet plays a role, antioxidants if somebody is consuming less of those, and again obesity, family history of diabetes, prolonged use of birth control pills, women having multiple partners or the partners having in turn multiple partners increases the risk. Early age of marriage and an early pregnancy increases the risk, and low socioeconomic status is also associated with it. Now, what are the warning symptoms which a female should always keep into consideration? If anyone has any of these symptoms like postcoital bleeding, postmenopausal bleeding, bleeding after menopause, intermenstrual bleeding, bleeding in between the periods, or excessive heavy flow, there is unusual vaginal discharge which is copious in amount and is foul smelling, pain during sex, or there is a persistent pelvic pain which lasts for a very long time. All patient who any of if patient has if some women has any of these symptoms, they should immediately consult a doctor. Now, as I had already said, that cervical cancer screening is a very good modality available, which can pick up cancer in a precancerous stage. And if anybody is about to get that cancer, we can treat it in the precancerous stage, where most of the times the treatment is very simple and less debilitating for the patient also. So the age-old thing is a pap smear, which should be done annually after the age of 40. There are better modalities available which are more sensitive. So if one of them is a liquid-based cytology, which needs to be repeated every 3 years. A more further specialized test, when we combine the liquid-based cytology with an HPV DNA test, then it needs to be repeated after every 5 years. Now, moving on to another growing problem of heart disease in our country. Now, it has been said that now, according to the statistics, there has been a 16 to 20% rise of cardiovascular diseases in women in 5 years, which is quite a significant statistics. Women are as young as, we are finding patients as young as 35 to 54 getting cardiovascular diseases. Now, why is there a rise? Because it has been attributed to the changing lifestyle. It has been said that women in the urban population, they are more stressed as compared to women who were 5 years back. That is actually the reason, and there is a scientific basis, there is a hormonal basis as well, because of a rise in cardiovascular diseases. And now the more alarming thing is that it is becoming the most major cause of deaths in females in our country above the age of 65 years. Now we need to know what are the risk factors so that we can check them, control them, and avoid the risk of heart diseases. The most very important is the lipid profile of the patient. So if the HDL levels are low, it increases the risk. Somebody with diabetes has an increased risk. Mental stress and depression, I don't need to tell, everybody knows that stress leads to high blood pressure. So sedentary lifestyle, again we have obesity here, so I'll be talking about it more later on. Smoking definitely increases the risk of heart diseases. Menopause, all the hormones present, the female hormones, they are said to be cardioprotective. So they have, they protect the females before menopause against any kind of cardiac illnesses, cardiovascular diseases. But after menopause, the risk increases tremendously, and somebody with a family history of cardiac problem should seek help at an earlier age and keep in check the other modifiable risk factors. Now, what could be the symptoms? Now, it has been seen that in females, the usual presentation of a myocardial infarction or cardiovascular disease would be a pain in chest. But it has been seen that in females, not all of them would present with pain in chest. Some would, present with symptoms which could have a multiple diagnosis, which could actually not pinpoint for a cardiovascular disease. So I'm highlighting on that because one should not, in that case, not neglect a persistent, pain in neck, jaw, or upper back, or abdominal discomfort, is shortness of breath, or pain in arms, persistent sweating, and unusual fatigue. Symptoms like these should not be neglected after you have reached 40. Now, what are the screenings available for? These are very simple tests. So, all the women after the age of 40 should get their blood pressure checked regularly, and if there is any variation, don't hesitate. If the blood pressure is little high, you should take your medications as prescribed by the doctor. They will benefit you. Please don't stop your medicines. If you feel for a very long time your blood pressure has been fine without consulting your doctor, a simple test of ECG, blood glucose has to be done regularly because dual reason for diabetes also. The lipid profile has to be checked because if the as it's very common to hear that cholesterol, high cholesterol can lead to, and that's a very common lead which everybody knows, and a stress test which actually checks your ECG under stress. Now, another important thing is which the females can encounter after the age of 40 is osteoporosis. So, why osteoporosis? Major highlight in women. So, what is the importance specifically in women? Osteoporosis can happen with age in both men and women, but since women tend to have smaller, thinner bones, so they have that increases their tendency to develop osteoporosis. And also, again, the hormone estrogen is even the hormone estrogen decreases after menopause, then it can increase the chances of osteoporosis. What happens in osteoporosis? That the bone density tends to decrease, which makes the bone fragile, and they get fractured easily. It commonly affects bone, it can affect the spine bone. So it is always better to take precautions rather than ending up with a fracture. Then again, what are the risk factors? As I've already told, as age advances, the risk of osteoporosis increases. Again, there is smoking, alcohol consumption, somebody with a small and thin structure, somebody who has persistent low calcium and vitamin D3 levels. Again, stressing on vitamin D3 here. A lot of females in the urban population have very low vitamin D3 levels, so they should keep a regular check, and especially after the age of 40, they should be taking supplements after getting it checked so that they don't land up in such kind of a situation. If somebody has a family history of osteoporosis, then it increases the risk. And a very important thing is lack of exercise. A brisk walk, any kind of an exercise, it brilliantly improves the bone density. So lack of exercise and sedentary lifestyle can increase your risk of developing osteoporosis. Now, going to the screening, we would advise that, as I had already told, that regular screening of your minerals, your calcium and vitamin D3 levels, and bone density test after one reaches menopause. If there is a family history or other risk factors, then one can get the bone density test done at an earlier age also. Now, another thing which really bothers females is menopause after the age of 40. Now, in giving you a brief idea, it's a major change, of course, for females. It can pass on very smoothly if any female is. In a lot of females, it can pass on smoothly. If one is, always I feel if one is prepared that it's going to happen and how it's going to happen and what all I'm going to face, I think it becomes easier for them, and it doesn't make them so apprehensive. So it's easier for anybody to accept that yes, this change is going to happen in my body, which is natural, which is going to happen with everybody. So I take it in a positive stride. What are the events of menopause? Typically, it happens at the in the age of in the age group between 44 to 52. When do we tell that a patient has attained menopause? When when one doesn't get cycles for about 12 months, and these can also be confirmed by FSH levels. Now, talking about perimenopausal and menopausal symptoms. Perimenopausal is the phase which is around the menopause, before and immediately after attaining the menopause. The average length of perimenopause can be 4 years, but in few patients it can be as short as few months or as long as 10 months also. Now, we need to know what all changes will happen in your body at the time or just before the menopause. Just before the menopause, periods can behave in 2-3 different fashions. Many patients complain that their cycles are prolonged, like they get their periods in a gap of say about 40 days, 50 days, 2 months. Gradually it tends to increase. Some would have even shorter cycles, that period happens every 15 days, ma'am, or every 20 days, or it could present as periods happening with a very heavy flow, or some lucky ones can just have an abrupt stoppage of period. So it can behave in any of these fashions. You need to consult your doctor if you have any irregularity in your periods, any of these irregularities, because we don't want, because heavy flows and shortened cycles could be sign of some other underlying problems which females can face after the age of 40. So believing that, oh, this is my premenopausal phase maybe, so no, but you should consult if you have any kind of irregular menstruation, so that we don't neglect any other problems which any other underlying problem which can also present as heavy flow, prolonged cycles, etc. Now, there can be hot flushes. Patients often complain that they feel very hot. There is kind of heat emitting from their palms and soles and face. This is something which you should consult your doctor. We have medicines which can help you in that to quite some extent. Yes, mood swings. A lot of females have, there is increased irritability. There is a lot of depression, and people say that, they have that irresistible urge to just crying because of no reason. This is all normal. It's just happening with, it's just because of some kind of a hormones which is happening. So you don't, don't make yourself responsible for all these things. Just by keeping a lot of positive attitude, these things can be handled. Easy fatigability. Patients have, they feel fatigued at after very little strenuous exercise. There could be urinary symptoms like urge incontinence or stress incontinence. There is a decrease in the sexual drive. Often patients complain of vaginal dryness and lack of sleep or trouble in sleeping, getting up. So you should, if you're facing any of these problems, please don't suffer. We have medicines, we have modalities to keep them in check, which are very effective in most of the patients, and they will make your lifestyle better. Now, coming to a very important aspect, which is the diet and exercise. We have seen in all the problems which we have discussed after the age of 40, diet and exercise, obesity and lack of exercise or sedentary lifestyle has been the major cause, one of the risk factors in all of them. So it is very important. Why is it important? Because there are lots of changes happening in a female after the age of 40, and due to which the basic metabolic rate tends to decrease, which in turn increases the waist, and the waist the weight increase is especially around the waist area. And if it is not checked at an early age, it becomes very difficult for a female to lose her weight at a later age, and then it becomes kind of a vicious cycle that a lot of metabolic disorders they start happening because of lack of because of faulty diet, lack of exercise. So it is very important, which is the main factor, that this is one thing. Exercise and diet is something which is modifiable, which is in our hands, which we can keep, we can keep a check on it. And since obesity affects the female in so many ways, we can reduce the risk factor of other lots of problems by just keeping the weight in check. So one needs to, by and large, broadly speaking, needs to decrease the calorie requirement, because the calorie requirement decreases after the age of 40. So what small changes we can make in our diet, which can help us keep our weight in check? Eating whole grains instead of refined grains. Whole grains, by whole grains mean whole atta, replacing having oats. These are very beneficial rather than having refined flour. Then one needs to increase the content of consumption of a lot of colored vegetables and fruits, because they are rich in antioxidants, they are rich in vitamins, which is required later on also. It improves your store also. Now, increased consumption of berries. Berries are very good for female body. They have a lot of, again, antioxidants in it. You should add a handful, what we advise is a handful of walnuts, almonds, raisins and figs in your diet, everyday diet. Then salt consumption and sugar, foods with high sugar should be decreased. We should increase the protein rich diet. For vegetarians, soy protein is very good. Milk consumption is very important, but one needs to consume a low fat dairy products always. Along with it, an additional, since with advancing age, an additional supplement of calcium, zinc and folic acid is recommended after consulting with your doctor. Now, talking about exercise, what is the importance of exercise in a female? A very important thing is that it keeps a check on the weight. It keeps the weight to an optimum level. The BMI should be maintained, and most important is that it wards off osteoporosis and it fights depression. Yes, exercise is when after a physical exercise, there are lots of feel good hormones released from our body, which make us, give pleasure and make us feel good about ourselves. So to ward off that, also to fight depression, also exercise forms an important role. Now, what all kind of an exercises one can do is that according to your looking at what it has to be, always has to be according to your body type, according to your energy levels, according to your previous exercise, what you have been doing earlier in your life. So about cardiovascular exercises, like on the treadmill or on a static bicycle 3 to 4 times a week for a certain amount of time, which you should be doing it under the guidance. Then high impact exercises can be done 1 to 2 times a week, again under guidance. And strength training exercises, so that it improves the muscle mass, and if the muscle mass increases, it improves the metabolic rate and it helps to keep your body toned. Excellent form of exercise after the age of 40 is yoga and Zumba and swimming. Now, concluding, I would say that along with all these tests, one should also get a regular screening after the age of 40 for their eyes. As age advances after the age of 40, all men and women all tend to have disturbance in their vision, so need to get their eye checkup done at a regular interval after the age of 40. Must get their thyroid profile, because thyroid disturbances can happen after age of 40, and they can lead to other, thyroid is one hormone which affects multiple organs of our body. So it is very important, if somebody is hypothyroid or hyperthyroid, it needs to be corrected well in time. Apart from that, blood glucose should be checked regularly, because you don't want to end up in diabetes. And along with that glucose, there are few specialized tests which need to be done to rule out diabetes, the blood pressure, as we had told. Now coming up to abdominal ultrasound, the whole abdominal ultrasound. A little elaboration on that the upper abdominal ultrasound helps us check, to rule out any kind of liver diseases, or detect any kind of gallbladder stones. There's a saying that we say that females with four F's, like fat, fair, female of 40, are more prone to develop gallstones. So an ultrasound can help us pick up, if there are gallstones, we can detect them at an early age, and before they cause any complications, a remedy can be done for them. Along with that, an annual lower abdominal ultrasound. It gives us a lot of information for patients who've had a very smooth menstrual history. Also should get an annual lower abdominal ultrasound, because there can be certain silent changes which are not revealing, which are in an early stage, maybe an ovarian cyst or an ovarian cancer, or any kind of other pelvic problem which is not producing any symptoms, can be picked by an ultrasound. Now, friends, I would conclude here, and thank you so much. I want to give you a take-home message that keep a positive attitude. Please take care of yourself. Once you take care of yourself, you can take care of your entire family. If you are in a good state, in a good mental and a physical state, you can take care of the family. And if you are not having any kind of a disease, if you're free from disease, then your mental state is bound to be very good. We here at Paras are contributing. We take special effort in counseling all the patients who come to us at the age around in their 40s or just before that, to get themselves regularly checked, so that we can help them detect any kind of a problem which they have at an early stage and treat it. Believe me, once the screening comes out clean, then most of the females, they say, oh, thank God, I am so relieved. So this is what the attitude is. So please take care of yourself and have a nice day.